Now, there's a chance I'm butchering this name, but there's a new medication that's out there that's approved for postpartum depression. Postpartum depression affects approximately 1 in 8 women after they give birth. They can go through this phase in which they get a clinical depression. And so there's a medication that is helpful for specific instances of postpartum depression. It's called Zuranolone. Another name is Zurzuvae. I may be butchering those names, but this medication is pretty unique because most antidepressants take months for it to work, but this is thought to work within a 14-day or 2-week span. Now, typically the dose is 50 milligrams for this 14 days, but you could start it at smaller doses such as 30, 25, or 20 milligrams, and it's supposed to be taken with fat-containing foods. It's unclear how this works, but it's thought to activate the brain's GABA receptors. And these GABA receptors that the brain activates basically is this calming cascade or calming mechanism. And so this medication maybe help these women who take it to sleep at night. So as a caution, it can sort of sedate the central nervous system. So there's a warning that people shouldn't drive or operate heavy machinery after taking this medication in case it causes them to get sedated, and they're more likely to get prone to accidents as a result. So the most common side effects are somnolence, sedation, dizziness. Interestingly, this is not indicated for major depression or clinical depression for just anyone, but specifically for postpartum depression and women suffering from postpartum depression. And so it makes me think, like, maybe does this medication just help them sleep at night? And so because they're sleeping better and they're more relaxed, that can help with their mood. Also, how many women after giving birth can really be on a medication like this that helps them sleep or cause them to get sedated or somnolent? Because oftentimes they're up to help care for and nurture their newborn. So those are some things to consider. Other side effects like somnolence, sedation, dizziness that are common, it's thought it can contribute to suicidality. Suicidality, which is really something that is a warning with all antidepressants, but typically antidepressants help protect against that. So, but also because it works on these GABA receptor system in the brain, it's thought that it can be an abused medication or someone can get dependent on it because a lot of the chemicals that work on the GABA receptor does that have potential for abuse or dependency. Like alcohol activates this GABA receptor system as well. So does benzodiazepines, which are well known to have abuse and dependence to it. Also, a caution, this medication is really expensive in like the tens of thousands of dollars. So it's really not that practical for most people. There's a good chance down the road that it can be cheaper. And this could be a reliable option for people going through a postpartum depression. But there's also some other important considerations for postpartum depression is that sometimes with postpartum depression, it can actually be a sign of a bipolar disorder. So if the mother has a bipolar, that should be important to be evaluated or screened out because sometimes postpartum depression could be more likely in patients with a bipolar disorder, and that would be a sort of different type of treatment. In particular, it'd be more of a mood stabilizing medication. Also, I'm not really sure what the side effects are on the baby. For example, if the mother is taking this and they're breastfeeding, that can go to the infant itself, and we're not really clear what those side effects for the infant would be. But if it's anything like the benzodiazepine types of medications or like alcohol, it's going to not be safe for the infants. That is questionable as well. But for the most part, being on antidepressants for a mother who is depressed is going to be helpful because it's going to help them, if their depression is better treated, help them care for the infant better than a mother who is depressed, not able to care for them. Most of the antidepressants out there are secreted in the breast milk, but again, typically the benefits of treating the mother outweigh the risks of the harms to the mother. Those are just some things to consider. I mean, there's so many factors that can play a role in someone dealing with a depression, as if they've had a history of depression, if there's a family history of it, are they taking any medications that could be causing it, or using any drugs or alcohol? Sometimes just stress, the stress of having pregnancy, the stress of not sleeping well, maybe it's financial, family life. There's so many other factors to be involved in treating depression. Medications are just one avenue. You could also go to talk therapy, that can help. So make sure to talk with your medical provider or mental health clinician about the treatment for depression. Also, maybe rule out any medical causes of depression, such as low thyroid, or maybe there's chronic pain or infections that can affect people's mood. So there's a lot of things to consider.